this afternoon, the Ghana Registered Nurses and Midwives Association is warning of a dire consequence if government goes ahead with its planned intentions to recruit 5,000 senior high school graduates to assist nurses at community health centers across the country. The Youth Employment Agency at the start of this month explained that its new job plan is to have senior high school leavers help nurses with recording of medical history and symptoms, conducting a physical examination and providing some simple bedside care to patients, mostly in rural communities. However, the Registered Nurses and Midwives Association is describing this particular move as worrying. The group has tabled some demands before government. Let's explain some of them to you. So first of all, the group is making some demands in terms of what the YEA intends to do. In terms of recruiting senior high school students, they are saying that the YEA would have to, as a matter of urgency, halt the training of senior high school graduates since the recording of medical history and symptoms, conducting a physical examination and providing of bedside care requires some special skills which can only be provided by trained health personnel. And in the case of this some of the nurses we're dealing with who have gone through some regulated training by the Nurses and Midwifery Council of the Ghana Midwifery Council, they would be better placed to provide safe and quality health services to the people of Ghana. Now, any further training of SHS graduates which does not conform to the standards set out by the Nurses and Midwifery Council will pose a threat to the lives of all Ghanaians, especially those in rural communities whose first point of access to healthcare, and in some cases the only access to healthcare, are the CHPS or the community-based compounds as government has set up. Now, furthermore, the group is also indicating that the Ministry of Finance and Health and government for that matter should, as a matter of urgency, recruit the thousands of nurses and midwives waiting to be employed, especially over 10,000 nurses assistants who have already accessed the Ministry of Health recruitment portal. The group is going ahead to call on all nurses and midwives awaiting posting and those waiting for the Ministry of Health recruitment portal to be open for them to remain calm as they work with leadership to get government to do the needful. And then the group is also, and this is a very critical point, asking the authorities to stop the politicization of nurses and midwifery in Ghana. Their belief is that this is getting out of hand, and as a result, the group is calling on every nurse and midwife not to commit themselves in any way to the training of any senior high school graduates who are not, going through the standardized training as stipulated by the Nurses and Midwifery Council of Ghana. So these are some of the demands that the group is putting across, explaining their displeasure as to the decision by the Youth Employment Agency to go ahead with the recruitment exercise. Earlier today, I got in touch with the General Secretary of the Ghana Registered Nurses and Midwives Association, David Tinkranchum, who told me that government would rather have to clear the backlog of some trained nurses waiting to be recruited. Listen.
A publication on Joy Online to that effect, and we have gone on this route before, so we are not surprised at all to see this thing being resurrected. So that was the reason. That is how it came to our attention. The YEA should halt that program. They can train people for various reasons. We have no qualms with that. But once they have specified that they are going to train people for that number of weeks to be sent to assist nurses, is where we have the problem. Because we have already trained nurses and midwives in the system, close to about 20,000 people who are ready for employment. 10,727 of them actually access the recruitment portal of the Ministry of Health for the past 9 months. And all what was left was to distribute them to the various agencies under the ministry for them to start work. That did not happen, or it has not happened up to this time. So what is the essence of going to use the taxpayers' money to train people again? And we read in their bullets that they will charge themselves in a manner, in a way that they could assist nurses by taking medical history. It appears as if they don't understand what constitutes medical history. Now, if you want to take medical history, it's not like what is your father's name, where does your father come from? You need specialized skill to be able to do that. So that is what we are saying. And then the second thing is that we have these people who are there, who assess the portal, and they are actually nurse preventive officers. You know, we have various levels of entry in nurse. We have those who enter at the degree level and the diploma and the certificate level. At the certificate level, we have nurse assistant clinicals and nurse assistant preventive. The nurse assistant preventive are recruited as community health nurses, okay, at the certificate level. So they are supposed to man these CHIP centers, and we have several of them in the system looking for employment as far back as 2019. So we think that it is not necessary to go on this route, and that is exactly what we are asking the government to do. And then those we have also come to the realization that there is bridled over politicization of nursing and midwifery training in this country. All right, we think that the politician must apply the brakes, allow the technocrats to run nursing and its institutions. All right, the interference is just too much, and that is what is killing the profession. And we want to stand as long as they will do the needful, because we are ever ready to collaborate with anybody, with any agency that will inure or that will do things that will inure to the benefit of the people of this country. But if they decide to go on this route, then it will not help all of us. Okay, I mean, when COVID broke out, my brother, we lost nurses, we lost doctors, highly trained, skilled personnel who understand infection prevention and the standards of infection prevention, lost their lives. Okay, so what makes you think that when these young ones are brought in, they will not be a danger to themselves and even to the society they purport to be serving? So what we are saying is that nurses don't need any assistance. If we need assistance, we need our own kind to assist us. And many of such are out there looking for employment. So it's very simple. Asking YEA agency or whatever to employ nurses. No, that is not their mandate. They don't even have the money to employ them. But they shouldn't waste whatever resources they have in employing SHS graduates. If they don't have the need for that money, they should send it back to government. Government will use it to employ the nurses and midwives and place them at the appropriate levels.
Because the point is,
government not get the money. If we are prioritizing the healthcare and the health of the good people of this country, we should be able to employ. How many is 20,000 nurses and midwives? Government can employ them. Let me tell you that. Of course, there was a backlog of nurses and midwives right from 2012. Okay, especially the privately trained nurses and midwives. And this government released about 5 financial clearances in succession in 2020 to clear all the backlog. So let me give that to the government. But we needed to work to offset future backlogs. And that is what we are talking about right now. So since 2019, especially those who were referred in 2019 up to 2020, okay, we have not employed our people. And that is the problem. You understand? Those who were referred in 2019 who never got employed with their colleagues are there. All cadre of nurses and midwives who completed it in 2020 have not been employed. All cadre of nurses and midwives who completed in 2021 have not been employed. These are the backlogs that we are talking about. And we are asking government to employ them. Nursing and midwifery are skill acquisition programs. And once you are not practicing for some time, you are likely to forget about it. And we need to be very careful because we want to raise the standard of care of nursing and midwifery so that everybody will be happy. Let me tell you something. There is research about, okay, that when a highly skilled nursing workforce, is deployed, they have the propensity of reducing mortality and increasing the standards of nursing practice. And that is where we want to go. To me alone, the basic qualification of any nurse or any midwife in this country should be first degree. That is where we should inch forwards. Because Nigeria here, I'm nurse not paper, before you can call yourself as a registered nurse or a registered midwife, you should have a first degree. And that is the standard we want to set. Okay? They are coming to take care of human beings. My brother, they can deploy them to agric, of course. We are looking for people to rear chicken and rest of them. They can go and do that. Of course, there are 3 weeks training or whatever training that they intend to give them. Can, equip them enough to be able to rear a good poultry for us, so that we don't even import poultry. Skilled personnel to man there. Don't forget that those people, they are human beings like you and I, and they have every right to equitable and safe healthcare. Okay, so they are human beings. Those who patronize the small clinics that you are talking about are human beings, and they need skilled personnel to take care of them. Don't let anybody deceive himself by thinking that the kind of work that goes on there is menial. No, it's not.
Well, so that's the position of the registered nurses. Let's bring in now Emmanuel Kwesi, who's head of corporate affairs for the Youth Employment Agency. At least we'll have an opportunity to understand the policy. Thanks, Kwesi, for your time here on The Pulse. Now, it appears that your initial plan was to recruit 5,000 nurses to at least do some simple bedside nursing works, but the professionals are saying that's below standard. Exactly what do you intend to do at the YEA?
I had a difficulty listening to the submission of my brother because of network issues. I couldn't hear anything at all. However, we have stated clearly, and I think they have a misplaced priority and a misplaced understanding of what the exact issues are, because they've raised these issues before and we have clearly given them answers. We agree and we reckon that the health service delivery is a very technical area that you can't mess up with. And of course, we'll duly acknowledge the work that they are doing towards the contribution of contributing to the health of Mother Ghana and everybody in here. So we acknowledge the work of doctors, we acknowledge the work of nurses, we acknowledge the work of midwives and so on and so forth. However, I'm not sure everybody can do every kind of job in whichever field they are. And we have a basis for what we are doing, which is greatly supported by the World Health Organization, it's supported by the African Union, and it's supported by the Parliament of Ghana, the Ministry of Health. In fact, we are doing this under the auspices of the Ghana Health Service. It'd be very surprising to believe or think that the Ghana Health Service, the Health Subcommittee of the Parliament of Ghana, and the Ministry of Health have not gone through all of these things that we are talking about and have not really thought about it. What we are doing is, first of all, to create employment for the young people, young men and women of Ghana. Secondly, to attend to primary health care delivery in preventable health care, and especially in the rural communities. We are not posting anybody to any big hospital like the Bank Hospital here in Accra. We are not posting anybody to, for example, the Tamale Regional Hospital or the Northern Regional Hospital in Tamale. We are posting them to the Chief's compound. We are posting them not to act as nurses. We have been very explicit on this. Not to act as nurses, not to act as doctors, but to act as preventive health service officers. My brother, you would agree with me that we are in the rainy season, for example. Cholera usually comes out as an outbreak every rainy season here in Ghana. What do we do that we get cholera as an outbreak every rainy season here in Ghana? It is because of little practices that we have in our homes.
Yeah, but if you may, I mean, if you look at the concerns from the group, they're saying the CHPS compound actually formed the basic unit of our healthcare system. You don't want to toil with that, particularly knowing how difficult it is for some in the rural communities to access some of the district facilities.
Why did we write that community health service providers are going to man the CHPS compounds? We haven't said that anywhere. We are not saying that they are going to be administrators of CHPS compounds. We have not said that they are going to administer injections to anybody. We have not said that they are even going to take temperatures of anybody. They are going to assist the professionals.
But there are a raft of measures, or I mean, some of the services they'll be able to provide, and that, for instance.
So, if I may,
you have a list of that. Yes,
explain it.
Right.
If I may, and he understands that none of our recruited people are going to provide these services that are provided by professional health service providers. And that is what we are talking about. That, for example, pick a folder for me. If I'm a nurse and I'm attending to a patient, pick a folder for me. What kind of expertise do you need to pick a folder for someone? Attend to or educate people in their houses on the fact that you don't need to defecate anyhow so that we can prevent cholera outbreak. What kind of expertise do you need to be able to do that? These are young men and women we are taking out of these communities, very remote areas where you post midwives and they don't want to go, where you post doctors and they don't want to go. That we should be able to prevent, for example, outbreaks. When Corona came out, we needed people to go into houses to educate people on how to wash their hands, how to bath, how to do things when they come back from town. It's the public and these people that you will get into place. These are people with aspirations to become nurses. And they call them SHS leavers. We don't call them SHS leavers. They are graduates of SHS. Some of them don't have the requisite certification yet. Others have the requisite certification, but they don't have the funds to be able to apply and get to the nursing training
but Kwesi,
institution.
you understand how sensitive this sector is. This is the health sector we're talking about.
We very much understand, yes.
Yeah,
we understand how sensitive the area is.
And I'm just interested in finding out, for instance, what level of training will be given to such persons. Because, for instance, the nurses are urging their leadership and, in fact, all of their membership not to participate in any training activity for these SHS graduates. They then move ahead to talk about political expediency in this decision to recruit over 5,000 nurses. Or SHS graduates.
I am saying that let's not have misplaced priorities. There are different categories of people. We understand that the health profession is a very great technical area. And so these people are not going to give injections, my brother. These people are not going to operate on people. These people are not going to take temperatures of people. That is the work of the nurses. That is the work of the doctors.
Right.
These people are going to assist. And I was asking you, pick a scissors for me, pick a folder for me, pick a knife for me. How is it related to the technical administration of health, if you want to do that?
But what even...
We are not going to do what these nurses and these doctors are doing. They should get that straight. And they cite the reason of the fact that there are a lot of people in the backlog who have not been recruited yet. And so we ask them that because I have 2 masters, and I don't have employment yet, somebody who has a diploma certificate and is recruited or getting the opportunity to be recruited. We have different categories, we have different allowances, we have different technical areas, we have different expertise. Our government is going to attend to us. It's different in its entirety. Because I have the 2 masters and I don't have the employment, everybody else should wait till I'm employed before. We are doing this program with the security services, Ghana Police Service.
Yeah.
They're telling that because Ghana Police Service hasn't had the clearance, financial clearance to recruit the 100,000 people that they need to become police personnel, we shouldn't help the young and upcoming ones who can help us direct traffic control.
Yeah, but Kwesi, the other side of the argument is the other side of the argument is why not allow that budgetary space to the consolidated fund so we could bring in more nurses if it is indeed that you have identified some gaps in the system.
That's why I'm asking that. Is that the argument they are making? That because they haven't been recruited, everybody else, every other employment, whether it is within their category or not, and we have stated clearly that this is a different category. So everybody else in that category of the junior high school or the senior high school, that will have some kind of stipend or allowance and be able to continue their education and get into the same level as they are, should stop because they haven't been recruited. Is that it? That is not in fairness to nation building. That is not in fairness to resource allocation. President Akufo-Addo had said some time ago that we are in a year of road building. Are we saying that because we are in a year of roads and we haven't constructed every road in the country, we are not supposed to make any allocations to the Ghana Education Service, for example? We shouldn't attend to security issues, for example. We shouldn't attend to agri, for example. We should concentrate everything on roads. Is that how they are making the argument?
Kwesi, we've known the YEA of running a number of modules, but not in the health sector. What's
we have
motivating
done health before,
this?
my brother. We have done community health worker program before. And this is always in.
Hello, Kwesi. It appears that we're having some challenges. Kwesi, if you're still there with me, I was just asking what's actually motivating this new approach. Your network appears to be bailing out.
If you can hear me, I'm still here with you.
Right, yes, if you could just make the point, yes.
Right. So I have explained to you that it is not a peculiar problem that we are coming out with, or a peculiar program that we are just coming out with. It's a program that we have run before. It's a program, I think we have run it at least twice, if my memory can serve me right. And as you can see, I'm in a car. So if I had gotten to the document, I'll show them to you. But we have run this program successfully before. And we run it with the Ghana Health Service, of which the GRNMA is part. We run it with the Ministry of Health, of which the GRNMA subscribes to. This program emanates, and it's under the charter of the World Health Organization. It's under a charter subscribed to by the African Union, and they know that there are problems of universal health delivery in some countries where we have impoverished communities, and we need to make sure that people have access. How many doctors do we have? Even if the 10,000 backlog that he's talking about, even if we get recruitment for each and every one of them now, we will still have the deficiency. We will still not be able
but you're
to
looking for less in terms of the number. You're targeting 5,000, correct?
Yes, we are targeting 5,000.
Yeah, but that's not up to the backlog. So why not expand it? Why not do a proper targeting exercise so we could bring on board all of the 10,000?
So we are actually doing targeting through the deployment. Then we are working, as I said to you, with the Ghana Health Service, and they are now telling us, they are even doing the deployment, and they are posting the people to where they think they would need their services and where they think their services will be relevant to the cost of health delivery here in Ghana. So everything is under the auspices of the Ghana Health Service. I'm surprised that our brothers and sisters will make the kind of arguments that they are making.
For instance, this may sound a bit far-fetched, but recently we saw even a student who went on TikTok to make some pronouncements. Even as a student, that created a lot of fear within the health system as people were, questioning the standards within the healthcare delivery sector. Now you're bringing on board SHS graduates. By the mention of the name alone, some persons may not want to go to the hospitals to seek medical care, particularly in rural communities. And the concern
so my brother, what I want us to
compound the problem. What would you say to such members of society who may begin to have some fears visiting the various CHPS compounds?
Everybody should have enough confidence in the people that we are putting out, because they are coming and working according to the regulation and the authorization of the Ghana Health Service. We will be monitoring them like we have monitored every other beneficiary of the agency. We'll be working with them like we have done with every other beneficiary of the agency. We'll be checking their security backgrounds and everything. Apart from that, they are working under these GRNMA staff. The registered nurses and midwives, they are working under them. They are working under the doctors, so they have no right to do anything out of their own will or out of their own volition. But I want us to place it this way. We have drawn a very clear distinction between the work of the health professional and the work of the community health service provider. The community health service provider cannot give you an injection. It doesn't happen anywhere, and it has never happened before. Our documents and everything that we have discussed with the Ghana Health Service says they cannot give injections.
Yeah, but they can do record keeping, right? They can do record keeping, right?
They can do record keeping.
That's a very essential component of healthcare delivery, you agree. And in fact,
the record keeping.
Yeah. If I don't get the records right, how do I work on the patient, for instance? And
the record keeping,
yes.
The record keeping is directly under the supervision of whichever health director is there, whether it's a nurse, whether it's the doctor, whether whoever is there, the record keeping is under their supervision. And we are also training them. We are not just deploying them.
Right.
We are training them from our end. We're having a training which is also led by the Ghana Health Service. So if it's a hospital record keeping, they are going to go through that before they are deployed.
Yeah, but in the end, look at the problem that may emerge. You deploy over 5,000 SHS graduates into the various CHPS compounds. They go there, meet the health officials who are mostly under the umbrella body of the GRNMA, and then they're now ordering their people not to collaborate with these persons. You see the problem there?
So it will be, if they decide to have a standoff, that's when there will be a problem. But as I have stated
but that may happen, you agree? That may happen, you agree?
If I can learn,
Right.
I have stated to you time and again, and I'll keep stating it, that we are under the auspices. We are working on this program under the auspices of the Ministry of Health, under the auspices of the Ghana Health Service. I'm actually to have a meeting with Dr. Patrick Kumar this evening. Are they telling us that a program championed and instituted in collaboration with the Ghana Health Service and the Director of Ghana Health Service has signed on to? The GRNMA says because they haven't been recruited, they are not going to work with us. Is that the case? And is it the case, as I have stated to you early on, that because I have a PhD and I don't have a job yet, or I am set to be recruited and somebody has been recruited, I'm not going to work with the person? Is that the position everybody should take in the country? And is that the position they are taking? That because others, or they don't have the opportunity yet, nobody in the country should have the opportunity to work? When they have different categories, when they have different sets of payments, when they have different arrangements altogether, and they are supposed to supervise them and train them so that they get the opportunity to go to school and become like them, because they don't have what they want yet, everybody should cease in growing. Is that the question they are, or the point they are making to us? If that's the point, then we can have a further discussion to that point. But if that's not the point, then they are with the Ghana Health Service. We have collaborated with them a number of times on different programs, on different activities. We are surprised, very much surprised, that they will go on this tangent at this very crucial time.
Finally, the modalities for recruiting these people. Have you started the recruitment? What will be the modalities and how do you intend to deploy them? Because 5,000 is not even enough in covering all the CHPS compound. You agree?
Yes, I agree with you. And of course, there is a potential to expand the program. And we're always talking to partners locally, the corporate world, development partners, and everybody to come on board. I mean, issues of this nature, like you said, issues of health are very pertinent to the country and to everybody. What we do with the recruitment is that, we have started already. For purposes of transparency and accountability, recruitment is online. Everything is online. So you go onto our website, there is a portal that you can click on and go on with your application. If you have any challenge at all, Youth Employment Agency, we have offices across the country, every district, every municipality, every metropolitan assembly. When you get into our office, you would have our men and staff helping you out to do your registration, which will still be online anyway. So it's very transparent, it's very accountable. You can go online now.
I was asking about the modalities because people would want to know what qualifications you'd be working with.
Like they have called them SHS graduates. We call them SHS graduates. They say SHS leavers, but we take it like that. People that have completed senior high school and are willing, have the passion to get into the health profession. We are welcoming everybody. We think that when we are able to train them this way, they get to observe the registered nurses, doctors, and midwives over the next 2 years, and they get into school. They will have hands-on experience. They will be well-versed enough to get the requisite education and the requisite qualification as early as possible, come back and help the whole society. This is our aim and this is our intention, whilst we create employment as well.
And I thought that would have been the last one, but of course the concern by the nurses groups claiming that some 10,000 in terms of backlog just gives us a hint of how, bad the situation is in terms of our unemployment here in the country. Going forward as YEA, what do you intend to do to fulfill your mandate as well?
We intend to champion the agenda of the President, His Excellency Nana Dankwa Akufo-Addo, to become the fulcrum and the pivot of his 1 billion jobs agenda. So if you look at the last 4 years, we've introduced a number of programs. Some we call exit strategies. We have the YEA Job Center, which is a platform that has a collaboration with the private sector so that we don't become a public sector oriented organization only. People can go online, graduates everywhere can go online, and we are connecting with companies from the private sector to load up their vacancies. So far, we've gotten a number of jobs, permanent jobs through that. We have the regional flagship programs, which is primarily agri-based. So we are doing farms, we're doing aquaculture, for example, in the Volta region. We are doing a maize farm in Wenchi, where we are training the youth in modernized and mechanized ways of farms, and then acquiring lands for them so that they can become self-sufficient. We have a program like the Artisan Directory, where we are getting people enrolled onto a platform like an Uber. So, for example, if there is a plumber, there is a fashion designer who we train, and those we haven't trained, but we help to get certification. We put all of them on a single platform so that as you are in the studio working now, you have a problem with your plumbing in the house, you can just get online, look for a plumber in your area, and then get the person connected to go and work. You pay online, and then it's off your head. You still can be at work and get this done. We have the work abroad program, and then the traditional modules as well, the community health worker program, which we are bringing on board currently. We are going to revive the community police program. We are talking to development partners, and especially we have begun conversations with the private sector corporate giants to look at their corporate social responsibility, how we can collaborate and create jobs. Everything is about creation of jobs for the young people of Ghana. We are getting into entrepreneurship as well. We've had several collaborations with NEIP, which will be rolling out very soon. You'll see, we have done some already. We have a fashion center in the Ashanti region, Kumasi to be precise, where we have already trained about 600 people in fashion designing. We are setting them up. Immediately we're able to fully set them up, we'll set another people or another batch in place. So there are lots that we are doing. When you have time, I'm sure when you give us invitation,
definitely
we'll come with pictures and videos, and we'll talk about all of this.
We'll find time to do that. So final date for the deployment of nurses, when are we expecting them in the hospitals?
So training, we will close the portal by the end of next week. And what we do, training will begin in a week. When that is done, that should happen in a month. Training should happen in a month. So by and large, within the next 1.5 months, we should expect to be rolling them out.
I'm grateful, and we'll definitely connect by then. I'm grateful, Kwesi, for your time here on The Pulse. Well,